Welcome to the Elijah Rising podcast. Elijah Rising is an organization empowering women recovering from sexual exploitation. This episode is going to help you become more aware about the issue of sex trafficking and inspire you to take action.
Hey, you guys, welcome back to the Elijah Rising podcast. I'm your host, John, and I'm joined today by a very special guest. This is Andrea Cressy, and I'm not going to give you all of her titles. I'm going to let her do that herself. But Andrea, why don't you just introduce yourself and share with our audience who you are, what you do, and some of the descriptions of your titles.
Okay, great. Sure. Well, thank you for having me. I'm super excited about this. And again, my name is Andrea Cressy. I am the Forensic Nursing Program Director for Houston Methodist. We have 7 hospitals in our system. We see patients for sexual assault, domestic violence, human trafficking, and elder abuse. I am a forensic nurse. I've been a nurse for a long time. Critical care mostly has been my specialty for about 28 years, mostly in the emergency room. And then in 2007, I became a forensic nurse. And in the beginning, we mostly just took care of patients with sexual assault. But since that time, we have found that forensics has evolved as well as, our nursing practice. So we, at our hospital, we started a program. It's been almost 2 years ago that we expanded. So now we treat our patients for human trafficking, domestic violence, and elder abuse.
Wow.
Yeah, so I'm what's called a SANE nurse. It is a sexual assault nurse examiner, and I am certified. I have a SANE, so that means that I'm certified not only nationally but internationally to conduct forensic exams. So it's a passion I've had for a long time, and I'm so thankful that y'all invited me here today so we can talk about such a very vulnerable population of human trafficking and how we're really working on educating our nurses, our staff, our physicians, just about the great need that we have to take care of these patients.
Wow. Yeah, I'm so glad you said all those things because I had no idea internationally you're recognized.
Yeah.
That's huge.
Yeah.
Well, first of all, just thank you for the work that you're doing. I don't think people understand the toll day in and day out examining trauma and inspecting trauma. And so could you speak to that, just the relationship that you have with Elijah Rising, the relationship that you have with law enforcement? How does a forensic SANE nurse become integral to both the restorative care, rehabilitation side and the law enforcement side? Sure.
So, it's huge with what we do to have our multiple disciplinary partners, which obviously Elijah Rising has been a great resource for us. We work with quite a few organizations in the greater Houston area with our human trafficking patients, so we're very thankful to have those resources. Law enforcement, we work with law enforcement, we work with Homeland Security, with the FBI, so it's all integral, and having our advocacy is huge, and the thing that I shouldn't say differs a lot, but it does in some respects with human trafficking patients is it's time is of the essence. There are, multiple concerns with them. Obviously, security and safety is one of the biggest ones that we address, the minute they hit our door. And then for them, their concerns, we have to really be very transparent. They're very nervous about even coming forward in the first place to see us. Usually when they come to see us, it's a pretty bad situation. So we just try to address that, we want to take care of them. We want to keep them safe. We do work closely with law enforcement. But with that being said, we also want to empower them. So if they're not a mandatory report, which a mandatory report is anyone that's under the age of 18, over 65, or is mentally handicapped. So if they meet that criteria where they don't have to report, we give them that choice. So because that's a huge fear for them and a huge concern. So, we leave that up to them. Certainly if they want law enforcement involved, we will get them involved for them. And then again, if they don't want law enforcement involved, then we honor that wish as well.
Can you break down, you said time is of the essence. I think people have been to the doctor before, they've been in an exam, but talk about those critical moments that as a nurse you have with this woman, whether her pimp is with her or he's waiting in the lobby. Can you just kind of break down that for us, those moments that you have?
Sure. So, just kind of, I'll start with sort of when they hit our door. And they come in various different ways. And we spoke previously about a screening tool that we use now. We implemented that, it's been about a year and a half ago in our organization. So it's a very quick tool that starts with our registration personnel, where they can kind of look at that patient and just, there's some red flags that go off the minute they come in, right? Yeah. They, a lot of times, don't have their own personal identification. They don't really know where they're at. That's another big red flag, not sure what city they're in. And then there's usually a person that's doing the talking for them. So that's kind of the big tip-off to begin with. And so then they usually relay that information to the nurse, just concerned about just the demographic piece. Yeah. So then the nurse, without really asking, full-blown questions, just the affect of what the patient is like. So is that person standing there doing all the talking for them? Does their complaint that they're checking in with, does it really add up? Is it really what they're there to see us for? Yeah. And so, that's kind of, it's just a simple 4-question kind of checkbox that our nurses do without really even asking. They don't even have to ask the patient any questions. It's really what they're observing that's going on in that kind of first face with the nurse. Yeah. So then if they're concerned, then that triggers a flag. So when they get back, now the doctor has seen that flag, and so has the primary nurse that'll be taking care of them. So our goal is to professionally handle, how do we get this controlling person that's with them removed from the room so we can speak with them privately. So we have to get creative because we all know pimps they're not going to go away easy. No. And if this is a pimp, so, we still have a lot of, kind of sorting out to do. So typically our first go-to is we ask them if we can get a urine sample. One of our big red flags is when that person that's with them wants to follow them into the restroom. Oh, wow. So we usually know, okay, there's no reason, we always say, you can wait right here and, we'll be back. And so that's our chance to kind of isolate them. And then we ask them, we're concerned. Obviously, lots not adding up right now. Yeah. And so, we have a safety plan if you want to do this. And, if you're in danger, we're here to help. Wow. Sometimes we can't always do it that way. Sometimes we'll pretend like they need an x-ray. To really get them out of the department because this person that's with them is very controlling. So we have to get a little creative as well. Absolutely. So in the event that they identify, which is very difficult for them to do, but in the event that they say, yes, I need help. So then we completely isolate them. We get security. Security goes. And usually at that point, when the security officer is going in to let them know that they're going to need to, leave the premises, they usually have a pretty good idea of what's going on. Oh, yeah. So, and it can be challenging. They don't always go easily. So we have to keep that in mind. So that's why I say, time is of the essence. And in this one particular case that I'm thinking of that we just had not too long ago, she had 2 cell phones going. Oh, wow. So, that's sometimes a red flag too. And they're very concerned about turning those cell phones off. So what we have done, and, lots of research with human trafficking and working with law enforcement and, district attorneys, things like that, we have what's called a faraway bag. So we ask them, you don't have to turn it off. You don't want to turn it off, but can you just slip it into this bag and we're going to hold it for you securely. Yeah. And what it does is it turns off all their tracking. Yeah. So the pimp can't track them anymore, even though sometimes they know they're there, but they can't relay messages to them. Wow. Because that was the one thing that we found early on as we started treating our human trafficking patients. they would be very willing to do the exam at first, and then the text messages kept coming in, and then it was like, okay, now I've got to go. I've just got to leave. So we always are very cognizant of that. And then the rescue agencies that we work with, we have to be quick, because usually, you know, they want to, you know, get them to a safe place. So, you know, it's like, we've got to, you know, get your exam done, get you going. And I think you and I had spoke about a patient that we worked with Homeland Security and the FBI. And I think this was kind of a really, she was a very challenging patient. She was brought in from Las Vegas and in a sting. And what was, I think, so hard for this patient was that, you know, she had been just for, you know, months and months when she was, you know, taken into trafficking. She had been given methamphetamine and heroin. So it was really difficult for her because, you know, she was withdrawing. And I mean, they literally had brought her to us right from getting her off a plane. So, you know, just all those issues, you know, that they deal with substance abuse. So we have to really, you know, be cognizant of that. And what does that look like? What can we do to help them get through the exam and medically that they're okay. So we definitely have some challenges when we work with our patient population that is being trafficked.
Absolutely. You know, I have this statistic because you shared it with me, but 88% of women who are being trafficked come through a medical portal in some regard.
Right.
Yet only 18% are identified as being trafficked. And so I know you spoke to the tool that you and your team created about 1.5 years ago, but what more in the training aspects do you think are critical for nurses and healthcare staff to carry as they're standing as gatekeepers for these women that are coming in and really responsible for intercepting them at such a strategic point in their journey? Are there places of just compassion or what are some tools? Could you break down some of the tools that you guys develop with healthcare professionals with the tool?
Sure. Yeah, and I mean, that is such an alarming statistic. And I think when I first read that, I was pretty shocked myself. So, you know, our best tool is education. And so providing education to our staff, and not only just our nurses and our physicians, but our housekeepers, our, you know, electricians, you know, registration folks. I mean, who's ever in that hospital setting, because it is such a vulnerable population and it's a very high risk population as well. So really our best tool is educating. And like we say, you know, if you see something, say something. If something doesn't add up, there's a reason. And, you know, we talk about, you know, our ER nurses are so phenomenal with their, you know, gut instinct when, you know, something's not right with the patient and they're very sick, you know, and it's usually that first, you know, kind of feel that they get that this patient's not doing well. And it's the same with trafficking. You know, there's those red flags. And I think, you know, when we talk about education with our nurses, they're like, well, it's uncomfortable. And it is uncomfortable. It's very uncomfortable to talk to them. And, you know, you don't want to seem accusatory because, you know, clearly they've been, you know, they've been told that, you know, they're going to be arrested, they're going to be deported, you know, so they have all these things, and law enforcement is bad. And, you know, a lot of times too, you know, they're just there, they just want a quick pregnancy test, or they want STD prophylaxis, you know, they just want, those pimps want them in and they want them out. So I think, you know, for us to combat that as best we can, I think, you know, we've got to empower our staff and give them the tools, you know, to educate them and not judge them. You know, that's another thing that, you know, I find as I do this training with not only our staff, but, you know, we work with our advocacy, with our communities. And it's easy to stereotype someone and you think, well, you could just leave, right? Why don't you just leave? And, you know, sometimes they have children involved. They have financial issues. You know, so I always tell my staff, you know, until we've walked in their shoes, we really can't make that judgment.
Exactly.
And it's so important to be supportive, because when you are supportive, you're going to get a lot more information from them. And sometimes even our doctors will say, it's so funny, I went in there and I spoke with them, none of that came out. And then the nurse goes in and it's like this whole, slew of information comes forward. So, that's really huge that we talk about that.
Yes.
What did that nurse do that made that patient, feel comfortable and feel where she could, actually say what's going on. And with the doctor, she didn't want to say anything. So again, it's just huge education on our part, and just learning the signs and, and what to do when we have identified and they have self-reported, because that's really, for them to, like I say, for them to come forward and actually say, this is happening to me, it's bad.
Yeah. I'm curious, is there any TBRI, trust-based relational models in the education process of nurses and health professional staff?
Well, there is. I mean, there's what we call trauma-informed care.
Okay.
So, and that's, a big one, because, and really the basis, the model of trauma-informed care is not only to build a rapport with them, but to empower them and to be very transparent with them. Because, when you think about them and where they're coming from, they don't trust anyone.
Exactly.
And rightfully so, right? They've been completely, taken advantage of and vulnerable. And, nothing is worse when we, are sneaking around or, we're trying to call the police and they're not, so we don't do that. I say, good, bad, or indifferent, we need to be very clear with them, what this plan of care looks like. And I think when they know that, going in that, I'm here to help you. I want to keep you safe. And anything you tell me is confidential. It really does change things for them. So,
I was pursuing medicine through high school and college and working as an intern at MD Anderson and different things. And I'm listening to you and I'm like, this is why I didn't make it in healthcare. I'm way too emotionally invested. And I think, the difficulty to be both a professional, but also caring, compassionate, and removing some of that sterile nature that typically comes when you're in a professional setting, and the expediency of building that trust in a moment with this young woman who you have maybe 5 minutes with, maybe 10 minutes with. And so I appreciate you sharing that. I know that trauma-informed care is a massive piece, and just understanding the levels of abuse and assault and years of dissociation and fragmentation that many of these women have been under. And so I appreciate you speaking to that.
Oh, sure.
I really want our listeners to be able to understand some of what you and your team experience on a daily basis. I think many of us, we have jobs that we think are hard, but you intercept trauma every single day in some regard. You're having to listen to it, you're having to see it. How does someone like you, in the position that you're in, maintain health? How do you maintain stability in the midst of everyone else's instability?
Right. And that's a really good question. And I think a question that we need to obviously work on a lot more. Self-care has become a really big thing. And I admit, when I was a brand new forensic nurse, we didn't really talk about it. It was kind of like you did your exam, you went home, and, you sort of had, your own kind of debrief. But now that's one thing, we have case reviews, we have meetings with our forensic nurses. And we do, especially because I review all the charts and I'll look through some of them and I think, wow, that must have been a really tough case. So I'll reach out to them and say, hey, I looked at the history of, the assault that you just did. How did that go for you? How are you doing?
Wow.
And, there's times where we do ask them, to get some emotional support. And usually it's, they're very willing to, because they understand that, and sometimes you think you're okay. I mean, through the years, I've left, and I, just kind of a one-off, and I'm thinking, what's wrong with me?
Yeah.
Something is not right. And then, and then when I let myself kind of debrief with someone else and start saying, that was what was going on with me. I just was, and I've always, I did pediatric trauma for quite some time, and I found that I wasn't a very good pediatric trauma nurse because I couldn't just leave it at the door and leave.
No.
I would wake up in the middle of the night and think about it. And then that's when you start realizing, I'm not healthy with this. This is causing me a lot of grief. But I think the good news is that we've identified this through the years and just nursing in general. And, what we do need to do to take care of ourselves. And really debrief is a huge one.
Oh, that's huge.
So, and getting outside, exercising, doing whatever you can, mentally to make yourself feel better. So. Yeah.
Thank you for sharing that. I think people lose it. They lose sight of the work that's needed, both on the field but also internally. I mean, we say this in our organization a lot. We are not the savior. And I think when people feel like they're the project and a savior has come to save them, it creates even more of that resistance.
Right.
And so I think bridging the humanity of who we are and the steps and the real care that's needed to keep endeavoring in the work that we're doing is huge. And I want to break off the taboo that we're just superheroes who just do the work.
Yeah.
We actually break down and we realized, oh man, that was a 5-year-old and I'm not okay with that. And so can we talk a little bit, I'll pivot back. You and I discussed over the phone just the difficulty of self-reporting. It seems kind of like an obvious answer of why it's difficult and why it doesn't happen, but can you speak to some of the cases that you've experienced where the signs were there? It was very, very obvious that this woman was being abused or trafficked, but she couldn't self-report. She couldn't self-identify with being a victim.
Right. And there, obviously so many different scenarios of, things that keep them in the life. But one case that I think kind of is really profound for me was a gal that had come to Houston. She was basically just kind of wanted a fresh start. She was young. I think she was 18 at the time. And went to work in a restaurant. And, when you listen to her story, you're like, wow. I mean, they were grooming her from the get-go. She didn't really have a place to stay. So, one of the managers, I believe, kind of let her stay on the couch, sort of. And so, when she sort of explained how it kind of got going and then how she became so vulnerable. And she said, when I left Colorado, it was a bad situation that I left. So it's like, I've got to make it here. So I can't let anybody know that all this is going on. And interestingly enough, when she was brought to us, she was handcuffed in a car and was involved in a high-speed chase. And they crashed, and thankfully she was okay. But that's what this guy who was / the manager versus, he was her pimp, really. And that's what he was doing. He was tying her up at this, apartment, and he was bringing, people in to violate her. And, but it was just, it was just so sad that she, she just sort of had this, he had everything over her. And the fact that, she felt like her family would be so disappointed with her, and she couldn't really reach out to them. And I just felt so bad for her because I knew that she felt so lost. And just giving her that hope. And what was really, I actually got a follow-up on her because she ended up going to court. But what was really interesting about that case is I was speaking with an advocate that had been working closely with her, and she had mended her, family relationships. And so it was such a great outcome because I was so happy to hear that because she was just such a sweet girl. So self-reporting is tough, because like I say, they come from such various backgrounds where, they talk about, oh, well, they're a runaway. But what are they running away from?
Exactly.
What's their home life like? What have they seen in their short years, to make them feel like, I'd rather live out on the street
Mm-hmm.
and basically be taken advantage of than live in this home. Some of them grew up in foster care.
Yeah.
So there's just a multitude of, issues that they have. And every single one of them that you talk to, I think the common theme is, I didn't want to be like this. I didn't want this to happen to me. And of course they didn't. But, you become so vulnerable in your situation.
Yeah.
And I had a patient one time, which I thought was so interesting because, like I say, they're all so different. And I happened to notice when I started the exam that she had a very interesting tattoo. So we started talking about it. And, tattoos are always a good way to build rapport because we talk about, hey, where'd you get that? And then you start saying, well, you got it, one in LA, one in Detroit. So there's something more going on, right? If you're getting these tattoos in all these different places. But this one in particular was a longhorn, and it was very interesting looking. So it kind of piqued my interest. And she was there for a sexual assault exam, but no report of human trafficking. So anyways, we kind of started talking about the tattoo. And by the end of the exam, we had a very good rapport going on. And by the end of the exam, she was showing me on Facebook all of the different girls that were basically being trafficked in the different locations that she was in. And all of this just kind of came out from the tattoo. And but interestingly enough, she didn't identify herself as being trafficked because she was actually that person's, girlfriend, and he wasn't seeing anybody else but her. But yet all these girls, well, this girl lives in Corpus Christi, and this girl's at his penthouse in downtown Houston, and this girl is over in Austin. And I, just kind of, my mind, I'm like, wow, So I said, it seems to me like this is a trafficking situation, because from what you're telling me. And I'll be darned, she just opened up. She said, I can't even believe I'm living like this. And, where in the beginning, it seemed so normal to her. And I know it wasn't just what I said, but it was just, fascinating to me to see, this kind of thing that seemed normal to her.
Exactly.
And kind of breaking it down. And then it was like she had this revelation, like, wow. What is he doing to me?
That's
So,
huge.
yeah.
And it was the simplicity of just building relationship, building
from a
rapport.
Tattoo.
Exactly.
Yeah.
It's a key. I think people don't recognize. And again, it circles back in with that savior mentality. If you had been so just intent on getting her to say what you thought she should say, or whoever's in the position of intercepting someone in trauma or abuse, we lose sight of the person.
Right.
And I think that could have been an opportunity where it was the first time where someone actually took notice of her and valued something about her and wanted to know more and was willing to listen.
Right.
And so I want to pull out those keys because it's significant that these women, and these men, it's truly the lack of identity of value, validation, and value. And so I just so appreciate and so honor the way that you give your life to seeing these women come to a place of revelation and breakthrough.
Right.
It's huge. Right. You were sharing a story with me just recently before we started about the woman who just testified in court. Can you share a little bit about that? Because as we were saying, it was so significant that she was a little hesitant and reserved, but at the end of the day was able to testify in that place. Can you just speak to, I want you to speak to the why it's so difficult. I know we talk about the vulnerabilities and, shame, but what's really at the core there of why these women, when all the facts are on the table, so much so that it's being brought before a judge, why it's still so difficult to just speak forth truth.
Right. Well, and I mean, obviously I'm not as well versed with the law and, and the prosecution part, but what I think, it just seems to me when you listen to them, they have other women that they have to be accountable to.
Oh, wow.
And then, I shouldn't say obviously, but I think, they've built that rapport with the other girls that they're being trafficked with. So for them to go forward to law enforcement and then make it all the way to a courtroom to testify, and that particular case was actually, it was a federal case.
Oh, wow.
She was trafficked, across state lines, that kind of thing. But, yeah, and the one thing also that I found very fascinating about that case was that our nurse that did the case, she was working with the federal prosecutor, and I didn't really realize this at first, but she took so much ownership, which, I mean, obviously we do, but in her mind, she thought if they get off, it's going to be because I did a bad exam or it was my fault. And I'll always remember what that prosecutor said to her, which I thought was so interesting. She said, honey, and she was very, you could tell she really was very transparent. She said, honey, you're just a small piece of my puzzle, but I'm going to nail this guy. And she did. And so, but I thought, that really resonated with me because sometimes we put so much of, this exam has got to be perfect and I've got to testify perfectly. And, so much is and she's right. We are a small piece of the puzzle. It's multidisciplinary and there's a lot of factors that come into it. Yeah. But we can't carry the weight of the world think that we're going to make or break this case. And that's taken me a long time to learn. So it was really interesting because, I wanted to support her. So I was there with her as she was, doing the pretrial interview and all that. So, I thought that was just kind of an interesting revelation for me as well. So
there's so many pieces involved.
Yeah.
That's really, really good.
Yeah.
Just as we're kind of coming to a close, what would you say to the general public that are listening to this podcast? Obviously I work for an anti-trafficking organization. You work on the front lines of intercepting women who are coming in with abuse. What do you say to the mom that's at home listening with her kids? What do you say to the guy driving to work who's listening to this podcast? How do we be more equipped in helping identify and helping support those who are in abusive and traumatic situations?
Yeah, and that's a great question because I think that we can all do our part, and especially in the community. If you see something, like I tell our nurses, if you see something, say something. And for these poor parents nowadays, they're dealing with these kids with social media and all these apps, and I think we found because I'm every time something new comes up, I'm thinking, where did that app come from? And we had, when COVID hit, we had a little gal, she was 14, and she had, the school issued iPad. And I may have told you about this, and the mom thought she was on her calculator doing her schoolwork, but it was an app that was behind the calculator. And she was met by a 40-year-old man who had picked her up at her home with her dog. And, she was very lucky, I believe, because she had her dog. That saved her from probably being taken into being trafficked. But that poor mom, I'll never forget when she was in our emergency room and she said, basically blaming herself, what did I do wrong? And you did nothing wrong. And obviously you're very, close with your child and you want the best for them and you didn't know, but like she said, I'm going to make that my mission now to know these apps and to set these parental controls. And I thought it was a school issued laptop, it wouldn't be a problem. But as we all know, these pimps, they're tricky, and they just, when I think you figure out one thing with them, then they've got another thing going. So I guess that's the biggest thing for parents is know what your child is looking at, and just know that these apps exist and they're secretive and they always find a way to your child. So, just make sure that you're checking in with them regularly, that you have those controls on their phone or their devices. And, and then in the community, I think I told you about the case where one of my coworkers was just out getting gas, and it was during the freeze, ironically, and she said there was a very nice SUV pulls up, and a young girl gets out, and she's wearing cutoff shorts and a tank top and high heels. And so clearly what was wrong with that picture.
Yeah.
2 older men, this girl who's probably freezing, dressed like that. So, you know, if the dress is not adding up, the situation wasn't adding up. And she said, I just knew something was wrong, and what should I have done? And, you know, obviously I don't want her to beat herself up, but I would have just called 911 and said, I'm concerned. So that's what people ask me, what do I do? I mean, we do have the National Human Trafficking Hotline number, but in an urgent situation like that, she goes, but what if it was nothing? I said, you know what? Err on the side of caution, because who knows what, you know, what will happen to these children. So call 911. So yeah, that's probably the best advice I can say. You know, if you see something, say something. And do our best to protect our children and, you know, these poor patients and, you know, people that have been dragged into this horrible life.
Well, we so appreciate the work that you do again. And this has been a really, really informative and educational podcast. And
thank you.
To those of you who are listening, we appreciate you tuning in to this episode with our forensic nurse, Andrea Cressy. Until next time, we hope that you guys follow all the work that Elijah Rising is doing. You can support us. You can go to elijahrising.org/donate and be a part of the restorative care process, the intervention process. A lot of what we do, again, intersects the work that Andrea is doing, the work that law enforcement is doing. And so we challenge you as you listen to this to discover the way that you can bring your piece and play your part in seeing justice come to our region. So thank you so much. And until next time, we'll see you guys.
Thank you for joining us today for this episode. If you were inspired by this content today, please share, rate, and leave a review. Also, please consider making a donation at elijahrising.org/donate. Your support helps us continue the vital mission to combat sex trafficking. Until next time.